The first question is to do with comorbidities. And firstly, COVID-19 seems to particularly affect older adults. Why is this so, Charles?
Yeah, as I mentioned in the presentation, Rick, older people are more likely to be immunocompromised. Their immune system is not as effective as in younger people. Furthermore, older people are more likely to have other comorbidities, including cardiovascular disease, hypertension, diabetes, respiratory diseases, and asthma. And they often have about 80% of those over the age of 75 will have 2 or more comorbid conditions, which increases their risk and susceptibility to complications from the COVID virus infection if they are afflicted.
Thanks. Are there any particular comorbidities that make older adults more susceptible to COVID-19?
Yep, along the same lines, I think it's the ones that I've alluded to previously. And these mainly involve those who may be immunosuppressed, those on immunosuppressive therapies, those who have cardiovascular disease, which appears to be the highest risk of future mortality, those who may have underlying respiratory conditions like asthma, those who have diabetes or are susceptible to other viral infections as well, are also susceptible to COVID-19 and complications from COVID-19.
Thank you. So if I'm a fit, healthy 70-year-old with osteoarthritis, I have no other comorbidities, should I be isolating to be on the safe side?
The recommendation to isolate is universal for all patients on the basis of their age. Those over the age of 70 are at highest risk. So it's important that isolation is one of the important strategies. The less contact, the less likely are older people to actually come into contact with someone who may have COVID-19. Until the situation improves, this would be the recommendation to minimize the risk. Osteoarthritis in its own right is not a risk factor. It is not an immune disease like rheumatoid or other conditions, so that wouldn't imply that you are at higher risk due to comorbidities, provided that you do not have any other medical conditions.
I have a couple of other questions here as well, and moving on to more like the rheumatic drugs. One question here is, I'm a 71-year-old and I take immunosuppressant medication. Is it safe for me to have my grandchild over to have a visit?
The short answer to that is we advise universal isolation or minimization of contact for anybody who's older, and importantly, those who have immunosuppressive therapy are at even higher risk. I know it's very hard not to have physical contact with your grandchild, but we should appreciate that your grandchild has contact with other people, so that not only do they bring the risk of them carrying the virus, and younger people are more likely to carry the virus and spread it without having symptoms. So it is very difficult to be clear about whether a young person is infected or not. And importantly, as I mentioned earlier on, they have contact with their parents, other young people, depending on whether they're going to creche or schools, etc., which may increase the risk of them carrying the virus and spreading it to an older person or someone on immunosuppressive therapy. So the recommendations are that it's all right to have verbal contact, it's all right to have digital contact. If there's going to be social contact, it should be more than 1.5 meters, but it is very difficult to stop your grandchild from running to you and giving you a hug, which may make it a bit difficult.
That's right. Okay. Also, there's been some talk about a shortage of some medications in Australia. So what do I do if I can't access any of my rheumatic drugs from my usual chemist?
Yeah. Unfortunately, the situation has been created by very poor advice from unqualified people, which has created a worldwide rush for some of these drugs that really we do not have a shortage of, and that should be used specifically for the reasons that we require them for. My advice to people who cannot get access to these medications from their own pharmacy would be to explore other pharmacies, and this is the advice I've given to some patients, and some of us would be happy to discuss it with some of our local pharmacists to see if they have access, and I have personally enabled some people to actually get their medication. And if you're really stuck, I think the hospitals do have supply, which I'm sure they would be happy to provide for patients who are on a particular medication that is required from their stores as well. Because I think no patient should be left without. And if it's absolutely impossible, then it is important that they discuss it with their medical practitioner to work out what are the alternative options that may be suitable substitutes, rather than simply stay off the medication.
Sure. Also, I know you mentioned this in your presentation regarding Plaquenil, and there's some talk that it does provide some protection for my immune system to fight against COVID-19. Is this correct?
The short answer is it is unproven. Certainly, there have been some unqualified sources that have recommended universal use of this as an agent to prevent or reduce the progression of COVID-19. At this stage, my advice is as follows: that anybody on hydroxychloroquine for the purposes of treating their rheumatological condition, rheumatoid or lupus, should remain on it. There may be a benefit. There's no suggestion of an increased risk of complications. For those who are not on it, at this stage, it is purely experimental. Although most of the data comes from a Petri dish, which is not in human beings, we cannot extrapolate that to mean that if it actually kills the virus or prevents it from actually replicating in a Petri dish, that it will to have the same effect in humans. There have been other studies in the past with other agents that have not translated into benefit. Furthermore, no drug is without potential complications. And I've mentioned the importance of cardiac disease and long QT interval and the risk of getting an arrhythmia, which can be significantly disadvantageous for some patients and can sometimes result in death. In addition, it can have some toxicity on the eyes itself. So my simple recommendation is, whilst it is experimental, there is no need to. Importantly, in Australia, we have a situation where community spread and spread of the disease is at a low level of 2% at the moment. And it is pointless trying to put people on experimental treatments, because we're not in a desperate situation where we need to do experimental things without adequate research. We have enough time, and hopefully some of the research trials that are occurring in Australia and overseas will provide us with data one way or another, or whether it's going to be beneficial or harmful in patients who may get COVID-19 infection.
Okay, thank you, and welcome back to our Q&A session. This is our third segment about the potential treatment and research. Dr. Inderjeeth, I'm self-isolating because I am a high-risk group, but I'm craving for company and to go out and do some shopping and odd jobs. When will a vaccine likely be ready for COVID-19 so that I could go out and venture out and enjoy myself?
Unfortunately, at this stage, we are uncertain about whether we will have a vaccine and when that may occur. There are a number of trials in Australia as well as overseas looking at potential vaccines that may work in this situation. Now, historically, we've had good success with some viruses, including the influenza virus, but not with upper respiratory infections. And we have not been able to find a virus for some of the previous COVID type viruses. So the most important thing is to be patient, get involved in any trials that may be available in your area, and hopefully in the next 12 to 18 months, we'll have some data on the efficacy and what the most appropriate vaccines may be. On a positive note, there are a number of trials throughout the world, and we are hopeful that at least one or two of these trials will provide a vaccine that is suitable, effective, safe, and durable.
Good. Well, that does sound promising. Another question, I've heard that BCG combined with flu vaccination might boost immunity. Is this true, and is this treatment readily available?
The first and most important point with regards to the combination of BCG vaccine and the influenza virus vaccine to try and reduce the risk of COVID-19, at this stage, there is no evidence for its benefit. There are a number of trials that are occurring, including one at the Charles Hospital, and I assume other hospitals as well throughout Australia, looking at the benefit of giving patients a BCG vaccine at the same time as they're having the influenza virus, and to assess this in a randomized setting, whether there's any benefit in terms of reducing the incidence or complications of COVID-19. Now, in terms of BCG vaccine, the rationale for why it is being considered is because it does have some positive effects on stimulating the immune system to fight both infections as well as cancer, and has been used in that setting in the past. However, once again, this vaccine is not suitable for all people and is highly restricted in terms of the groups that we offer it to in Australia, and it's mainly for young children and those who may be potentially exposed to overseas travel or of immigrant parents at high risk of tuberculosis. So at this stage, unless there's a research setting, it is not widely recommended as an important strategy in reducing the infection or complications of COVID-19.
Thank you, Charles. Hello again. This is the final segment in our Q&A session, and it's about accessing medical services. Firstly, how will my rheumatologist be able to review me and prescribe biologicals via telehealth? Doesn't he need to see me and examine my joints?
Rick, that's an important question, because a number of the biological therapies that we do prescribe require an adequate assessment of response to ensure that we're giving it to the patients who should be on it and who are getting adequate benefit. These agents are not without complication or risk. They are significant, what we call immunosuppression drugs, and should only be used in people who are benefiting. So it's important that these are reviewed. Where there is a requirement for what we call a joint count, for example, a swollen and tender joint count and blood test. The important thing is that the PBS and the Australian government have made some consolations, including allowing patients to get access to this treatment if they have an adequate response, utilizing some of the teleconferencing facilities, which includes a teleconference with or without a video. So I would recommend that the patients speak to their rheumatologist, immunologist, or other doctors prescribing their therapy to discuss this, as it is feasible in most situations to be able to offer people access to their treatment during this difficult period until the situation normalizes again, so that they're not deprived of these treatments.
Mm-hmm. Good, thank you. Also, I have another question for one of our consumers who has osteoporosis, and the question is, I have osteoporosis and recently stopped going to my exercise class because the services shut down because of the coronavirus. How long can I take a break from the classes before my bones start thinning again?
Okay, well, the first thing, Rick, is that exercise begins at home, I say. So you don't have to go to a class in order to exercise. So I would recommend that if you cannot go to your exercise classes, try and get together a program of exercises, either from your physiotherapist or your exercise physiologist, or I'm sure the Arthritis Foundation will be happy to provide you with a series of exercises, or your physician or clinician would be happy to do so. And there are a number of these exercise programs available on the net for weight-bearing exercise. It's important to remember that in patients with osteoporosis, if you don't use it, you will lose it. So, within a matter of weeks or months, you will start losing the benefit of the bone density improvement you've had. And importantly, you will actually lose the strength and balance that you have that reduces your risk of falling over. So I think it is fundamental and crucial that you maintain your exercise program in some form. And this is especially a problem with those who are frailer, who are already at risk of falls, and who have worse bone densities, who have the least amount of bone or muscle to lose, and at higher risk of falling over and breaking a bone. So the short answer is try and exercise within your environment as best as you can. People living at home now have a lot more free time, so with no other distractions. So exercise should be a major important component of their regime and routine at home, which is not only good for their bones and their muscle, it's also good for their physical health, their cardiovascular health, and importantly, mental health. And I think I will throw in that it actually reduces the risk of dementia as well.
Excellent. Sounds good. Well, I can throw in a plug for us now, because if you are interested in exercise, if you go to the Arthritis and Osteoporosis website, you'll see that we are doing some exercises online, and hopefully we can encourage the consumers to continue on. Another question I have here, which is our final question, is I have OA of the knee, and I am waiting to see an orthopaedic surgeon in the public system about the possibility of a knee replacement. My appointment has been postponed for another 6 months at least. What can I do in the meantime to help my knee?
So I think that's an excellent question, Rick, because I think all the evidence suggests that what we call prehab or exercise is a fundamental and important component of any plan for surgery. So this is a great opportunity for people who may have joint problems, for example, osteoarthritis of the knees or hips, to actually try and strengthen their muscles. And if they actually improve their muscle strength, they will do a lot better post-operatively, and their recovery period after the surgery will be expedited quite significantly. And in terms of exercise, and once again, the Arthritis Foundation would be a great resource. It is important to emphasize range of movement exercises as well as low impact activities, because you do not want to cause any damage. So the main intention is to try and improve your muscle and muscle strength without having a negative impact on the joint itself. And with good advice, you can actually get a good series of exercises that can actually improve your situation preoperatively. And in fact, I would argue that there's reasonably good evidence that exercise is an excellent way of actually delaying your time to requiring surgery. And it wouldn't surprise me if some of the patients who actually decide to do these programs may well find that they no longer require their surgery or are able to defer it a lot further than the waiting list within the hospital system.
So we can't stress enough the importance of continuing an exercise program no matter what. Exercise is a very important component to good health.
Without a doubt.
Thank you very much for your input with our webinars. Dr. Inderjeeth, it's been very much appreciated. And once again, thank you very much for your time.
Thank you for the invitation, Rick.